Hello and welcome to our first of 4 webinars on meeting complex needs of our clients. I'm Anthea and I'm going to be your trainer throughout the next 4 webinars. In this session we'll look at planning and conducting activities for older people, including establishing participant needs and expectations, planning recreation programs, preparing for recreation programs, and conducting and concluding recreation programs. We will commence this session with talking about establishing the needs and expectations of our clients, whilst focusing on finding out information about our clients' specific needs. The first step in planning a recreation program for older person is to establish information about our clients' characteristics. This could include things such as their age, their medical conditions, medications they take, their level of mobility, and their level of fitness, etc. We then need to find out information about the client's recreational needs. This can include things such as the client's physical needs, their emotional needs, and what motivates this person. The third thing we're going to find out is if the client has any special requirements. This may include any requirements in relation to the challenge and difficulty of the activities, if they require cognitive or behavioural support, and if they need any assistance accessing the activity or with their mobility, etc. Let's now look at the different types of participation needs and their impact on program planning. First of all, there's physical needs. A client's physical needs may relate to their physical mobility and their level of fitness. It can relate to their ability to access a fitness venue and their ability to use the equipment. If a client's physical needs are not appropriately addressed during the program planning stage, the client may not be able to participate in the activity, or the activity may not be safe for them to participate in. The next thing we need to consider is the emotional needs of the client. A client's emotional needs may include things such as the need to feel safe, involved and welcomed, and their need to have their anxieties and frustrations addressed. To address these needs, it's important to incorporate appropriate levels of understanding, empathy, and support during the program planning phase. The final thing we need to consider is the motivational needs. Many clients require support to increase and maintain their motivation to continue to participate in the recreational program. We are now going to talk about why it's important that you are familiar with the legislative and regulatory requirements that support and facilitate safe conduct of recreation programs for older people. First of all, let's look at workplace health and safety, known as WH&S. This refers to the legislation and guidelines in place to keep yourself and others safe within the workplace. Formerly, each Australian state and territory had its own work health and safety laws. However, since 2012, a number of Australian states and territories are working collaboratively to develop an OH&S Act which can be applied consistently across the states. This piece of legislation is known as the Work Health and Safety Act 2011, and it works with the states or territory OH&S legislation where applicable. Under the Work Health and Safety Act 2011 and the state and territory equivalents, you are required to fulfil a variety of workplace safety requirements. You may want to refresh on your previous knowledge around workplace health and safety at this stage. Another important thing to consider is privacy and confidentiality. In your role as a leisure and health staff member, it's essential that you observe people's rights to privacy and confidentiality. Under the Privacy Act 1988, you're required to maintain the confidentiality of clients who attend your services, as well as that of other staff members, the program itself, and the wider community where applicable. Fundamentally, this means protecting a client's private information and avoiding sharing private information unnecessarily. Most importantly, you must manage a client's information in a confidential and also a secure way. Another important thing to consider is duty of care. It is an essential aspect of duty of care for all professionals in all industries in Australia. Duty of care is owed to a person, for example the client, who may be affected by your actions, advice or your admissions. Duty of care may be owed to an individual and or by the organisation providing care to the client. A breach of duty of care occurs when you or your organisation fails to provide the service expected. That is, you fail to do what is reasonable to the client to prevent them from being in any harm. Another thing to consider when working with clients is equal opportunity and anti-discrimination. Discrimination refers to the unjust treatment of a person on the grounds of a point of difference, for example, due to them having a disability, their age, their gender, etc. It can be either done directly or indirectly. Equal opportunity principles work closely with anti-discrimination principles. Equal opportunity principles state that all people must be treated equally and fairly, regardless of diversity such as gender, disability, etc. All states and territories have Equal Opportunity Acts, and you may want to familiarise yourself with these as it applies to your role as a leisure and health worker. In addition to legislation, you must also be familiar with the organisation's policies and procedures. All organisations have policies and procedures for a wide variety of different things. Policies and procedures are important because they explain how to apply the legislative and organisation requirements and your expectations in your day-to-day work. A policy is a written statement which explains why workers in an organisation should undertake a task in a certain way, whereas a procedure is a written statement which explains how workers in an organisation should undertake the task. Please make sure that you're familiar with the difference between a policy and a procedure. You should familiarise yourself with the variety of policies and procedures in your workplace when you're on work placement, and particularly those that are relevant to your role. You must know where these policies and procedures are located, how you can access them, and then most importantly, how they're applied within your workplace. We've previously spoken about the importance of obtaining information about a participant's characteristics, their recreational needs, and their special requirements. As we just discussed, it's important that you encourage your client to articulate their own recreational needs and expectations. And you can do this by using a good quality questioning technique. Questioning is simply a process of asking questions about an issue. They may be structured questions, such as simple questions which ask about a single thing, such as what would you like to achieve by participating in this program? Or it could be a compound question, such as what would you like to achieve by participating in the program, and what types of activities do you think would help you to meet these goals? Compound questions are often confusing and in most cases should be avoided because they're two questions that are joined into one. Questions may also be open. That means they encourage longer descriptive answers. These are useful when you're seeking detailed information, for example, about a client's needs and their expectations. Questions may also be closed. That is, they require a yes or no answer. These are useful when you're seeking a clear and rapid response. When speaking with your client about their own recreational needs and expectations, it's important that you allow clients to articulate their needs and expectations in their own words. When working in leisure and health, it's important that you're able to make assessments of or screen a person's capacity. That is, their ability to participate within the recreational program. This is often achieved by using a pre-exercise health screen tool. We're now going to look at an example of a pre-exercise health screening tool here on the slide. As you can see on this slide here, that the tool asks the client numerous questions that will then give you information to determine if the exercise will be suitable and safe for the client or not. There are other types of assessment that you may conduct. This includes interviews with the client and their family members or carers. So that may be that you're using the screening tool that we just looked at the previous slide with a conversation with the client or their family. You may review a client's medical history. You may test a client's physical abilities by asking them to perform versions of the activities to see if they're able to do so. It's important that you conduct assessments and screening of a participant's capacity in consultation with relevant support staff. This may include medical and allied health staff involved in the care. It's important that you conduct the assessments and screening within your scope of responsibilities. To conduct assessments and screening of a client's capacity, as we've just discussed, it's important that you're aware of the psychological issues affecting older people, the impact of ageing on participation in recreational activities, and the variation in older people's abilities. So we're going to look at each of these areas now in greater detail. We're first of all going to look at psychological issues that may affect older people. This may include things such as a recent loss of a partner, family and friends, and therefore there's a change in their social group or their social support system as people around them become unwell or may pass away. They may become grandparents or great-grandparents. Clients may retire and therefore have a subsequent drop in their socioeconomic status. They may have increased dependence on others for basic needs. There may be changes within their living situation. For example, the client may move into an aged care facility. And they may have other psychological issues associated with limited mobility, chronic pain they may experience, and frailty. There may also be variations in older people's abilities. These normal anatomical and physical changes result in the expected variations in an older person's abilities. For example, older people may notice a reduction in their vision, hearing, and other senses. They may experience a decline in their strength, flexibility, and balance. They may notice a decline in their cognitive function, and they may experience a decline in their general balance and coordination. Ageing may have a variety of serious impacts on a person's ability to participate in recreational activities. If an older person is, for example, physically impaired, they may be fatigued, frail, in pain, have limited mobility or an unmet physical need, or they may be cognitively impaired. For example, they may be confused, disorientated, or have a behaviour of concern. They may find it therefore difficult to participate in a meaningful way in the activities. This may be due to simple challenges. For example, the client may also have difficulty accessing venues or using the exercise equipment that's made available. So it's important that we consider the impact that ageing may have on a person's ability to participate in recreational activities, the variations in an older person's abilities, and the psychological issues that affect older people when we're planning activities. We will now look further at potential barriers to an older person's participation in recreational activities. It's important that you understand a variety of common barriers to participation in recreation programs. These can include the lack of time to participate, the lack of interest to participate in the activity, the lack of energy to participate, or they may be in too much pain, etc. The client may not be feeling well enough or may be too unfit to participate in a physical activity, or they may lack motivation to participate. Your clients may experience a wide range of barriers to participation. One of the best ways you can find out about these barriers is to ask your client or their family, or any medical professionals that are involved in their care about these barriers. You may also be able to observe these barriers when you're working with your clients. In performing an assessment and screening of clients, as we've just discussed, it's important that you're aware of contraindications and precautions that may affect participation within the recreational program. Different contraindications and precautions are relevant for different types of programs. However, some common contraindications may include the presence of infectious disease. For example, if your client has gastroenteritis, it would not be suitable for them to leave their room and to participate in the game of bingo. If there's a risk of infection, for example, if they have an open wound. If they have a behaviour of concern, for example, if they become aggressive towards other clients during activities, it may not be suitable for them to attend certain activities. If they have anxiety or fear related to the activity being undertaken, or they may have a variety of medical conditions, such as exercise-induced chest pain, so therefore it would not be suitable for them to participate in some physical exercises. When screening a client and you identify contraindications to their participation in the program or any other issue that concerns you, it's essential that you refer them to the appropriate person if they're outside of your scope of practice. These medical and allied health professionals may include a dietitian, a continence nurse, a GP, an occupational therapist, an osteopath, a physiotherapist, a podiatrist, a psychologist, and a remedial massage therapist, just to name a few. These professionals have a role in, first of all, completing a more detailed assessment of the client, then diagnosing the client's health or other needs, then designing a program of interventions to meet the client's needs, and evaluating these interventions. In performing these roles, these professionals will assist you to design recreational activities which will better meet the diverse needs of your clients. You may therefore work closely with these professionals throughout the process of designing and instructing the recreational programs. Once you've identified participants' or clients' characteristics, recreational needs and expectations for a program, you can begin to plan the program. This involves determining a program's activities and strategies, which are appropriate to the context and that are appropriate to your participants' needs and capabilities. It's important that you have the knowledge necessary to match the activities with each individual's needs and their capabilities. In particular, you should have some knowledge about suitable exercises for older people. These exercises may include things such as stretching and mobility exercises, for example, yoga. It can include things such as strengthening and conditioning exercises, such as lifting appropriately sized weights, gentle squats, rowing or pulleys. It can include things such as confidence building exercises. This involves completing day-to-day tasks which a client may be experiencing difficulty with, such as practicing walking up and down the stairs. It can include posture exercises, such as standing straight, balance exercises, such as balancing on a line or standing on one foot. It may also include things such as chair-based exercises, which involve stretching and chair dancing. Or finally, it can include floor work exercises for the older clients that are physically fit, such as modified push-ups or kneeling. Before clients commence any exercise program, they should be first of all assessed as safe to participate, for example, by a physiotherapist. An important part of this process is to identify and incorporate injury prevention strategies. Some examples may include engaging in the hazard or risk identification process, ensuring that slip, trip and fall hazards are appropriately managed or eliminated, routinely checking all equipment and resources to check that they're in working order, ensuring modifications and aids are used appropriately, providing clients with assistance, fitting and using equipment, considering and addressing any emerging risks to participant safety, and encouraging clients to engage in warm-up and cool-down activities to reduce the risk of any muscle damage. It's important that you are able to document a plan for the recreational program that you've developed. There are a variety of ways that you may document a plan, and it's important that you're familiar with the organisation's policies and procedures when it comes to documentation. Consider the following example of a program involving an aquatic session for a group of clients. As you can see on this slide, the plan indicates things such as the time that the client needs to be there, who needs to be there, and the goals, what the activity is, what equipment's required, and any other notes. The detail in this plan means that it's easy for anyone to pick it up and know what needs to be done with the clients. A program plan typically comprises of a series of session plans. These session plans work together with the aim of assisting the clients to progressively achieve their goals. A simple version of a session plan was just discussed when we looked at the aquatic session plan. It's important, though, that session plans are developed as per the organisation's policies and procedures. It's important that you're able to develop and document session plans that cater for beginners, intermediate and advanced clients, and that they contain low and high impact activities that are suitable for clients' specific needs. They need to meet the client's goals. They may include things such as what exercise to use, what equipment or music is required. It may be written in the session plan about the fitness level of the participants, the environment in which the session is to take place, the type of session you've planned, and the timeframes for these sessions. It's important that the session plan that you develop incorporates a whole heap of key information. For example, the names of the participants, the date, location and goals of the session, the main activity you will implement, the estimated timeframes for each activity, the resources required for each activity, the notes with reminders about how the activity should be implemented, the support staff required for each activity, and any relevant hazard or emergency procedures that staff will need to be aware of. We are now going to look at the importance of seeking agreement from others on the program. In particular, you should seek agreement from relevant staff. These may be the staff who fund the program, such as your work supervisor or your manager, or those that will be involved in implementing the program, such as other leisure and health workers. You need to get agreement from the clients. Remember, it is your participants who will be able to provide you with the most accurate and relevant information to whether their recreational program is meeting their needs or not. And in some cases, you may need to get agreement from other organisations. This can include people such as local council, if you're having to do things such as hire equipment or hire a venue. We are now going to talk about inspecting and confirming the location of the activity. It's important that you inspect and confirm the setup for the location and any equipment that's required for the program. Ideally, this will be done at some point prior to the commencement of the program. This usually includes visiting the location to confirm that it's fit for the purpose, visually checking and trying the equipment to ensure that it's fit for the purpose and in good working order, and confirming in writing the availability of their location and equipment required. Any issues that you identify in this stage should then be reported to your supervisor. In preparing a client for participation in a recreation program, it's important you issue clients with equipment and aids that they require to participate. Examples of equipment and aids you may include for use when it comes to general exercise can be examples of sporting equipment. For example, weights, including dumbbells, rehabilitation weights that may be strapped around a client's wrists, and handballs that can be attached to a resident's fingers or client's fingers. It's important that you provide clients assistance with the fitting of this equipment and any aids. It's also important that you modify the equipment for use by each individual client. For example, for clients who are less able, you may reduce the amount of weight or resistance provided by a piece of equipment. You may decrease the speed of a treadmill or ensure the availability of a chair with rubber stoppers or with back support. For clients who are more able, you may modify the equipment in the opposite way to increase the challenge and the difficulty of the exercise. While your recreation program is being implemented, it's important that you continue the hazard risk identification process. That is, that you identify any emerging risks to participant safety. When observing and monitoring clients, it's also possible you identify contraindications which may affect their participation in the program. Just remember, as we've previously discussed, these need to be referred to the appropriate allied health professional as soon as possible. In addition to problems with exercise intensity and contraindications to participation, there may be a variety of other emerging risks to participant safety. If you identify any of these risks, it's important that you take appropriate action to minimise the risk. You may do this by using the standard risk management process, providing clients with additional support, implementing a rest period to allow the client to recover from the exercise or activity before moving on to the next, modifying equipment and aids for the activity, ceasing the activity if required, and implementing emergency procedures such as dialling 000 and asking for an ambulance to attend. At the beginning and conclusion of each recreational session that you implement, it's important that you encourage the clients to warm up and then cool down. Warm-up exercises are designed to gradually increase the activity in the cardiovascular system, increasing the flow of blood and oxygen to the client's muscles and reducing the risk of injury during subsequent exercises. Cool-down exercises are designed to gradually return the participant's cardiovascular function to the baseline, and they reduce the risk of muscle soreness following exercise. People should spend 5 to 10 minutes warming up and then spend a similar time cooling down. Both warm-up and cool-down exercises usually involve some type of stretching. When supporting clients with recreational programs, one of the most important types of communication that you can use is active listening. Active listening and responding is a two-part process. Active listening means that you listen to and understand what's being said by the other person. Active listening also involves contributing to the conversation that's being discussed and showing an interest. In addition to using active listening, it's important that you encourage and support your clients in other ways. For example, verbally. In the course of a person's activities, you may say things such as, "Excellent job, that's a great effort. I can see you put in a lot of effort today. Well done." You may also provide a person with feedback on their results. "Since you've started participating in the sessions, look how well you're doing. Look at the strength and balance that you've built up." And you may pass on positive feedback from others. For example, "Your doctor said that your cardiac function has improved since commencing the program. Well done." In conducting recreational programs with older people, it's important that you're aware of factors affecting group dynamics, conflict resolution, and communication strategies. Let's have a look at these now. First of all, there's verbal. Verbal communication is a key communication strategy. It's crucial to facilitating effective group dynamics. It's also an important aspect of conflict resolution. For example, in terms of enabling effective negotiation skills. However, it is important to remember that you may work with clients who are able or unable to communicate verbally. In situations such as a client is unable to communicate with you verbally, you'll need to have other strategies in place in which that they can communicate with you. There's also modelling and demonstration. This involves a practical example of how to participate in the activity. It may be a strategy that's used to enhance group dynamics. Ideally, modelling and demonstration should be accompanied by the verbal instructions as well. Finally, there's hand or arm signals that are useful for communication strategies in the context of group work. It's important to remember that at least half our communication is achieved through body language. Hand and arm signals may be informal in nature. For example, you may use exaggerated hand and arm movements to emphasise the point. They may be formal in nature, for example, to communicate with a person who uses sign language, such as Auslan. We're now going to look at Braille as a form of communication. As with hand or arm signals, Braille is a useful communication strategy in the context of group work and conflict resolution. Braille is the tactile form of reading and writing used by people who are blind and vision impaired. Braille is based on a 6-dot cell with 2 columns of 3, like on a dice. The dots in the first column are numbered 1, 2 and 3 from top down, and the dots in the second column are numbered 4, 5 and 6 from top down. By using any number of these 6 dots, 63 different patterns can be formed. Braille letters do not resemble printed letters. Each letter is either a single dot or a combination of dots. As previously discussed, it's important to remember that you will work with clients with a variety of different physical and mental abilities. It may be necessary to modify a recreation program to better suit these needs. It's particularly important that you're aware that you are able to modify a recreational session that can then be best suited to the client. For example, for a person with cardiac or respiratory conditions, they may need to reduce the amount of physical exercise they're doing at one time, or they may need to have a break in between to reduce the intensity and the pressure that's put on their heart and their cardiovascular system. Modifying programs for a client may also involve modifying the program's technique, considering the client's needs, objectives and their likes and dislikes, adjusting the technical difficulties of the exercise, and providing support and aids, including modifying the equipment. When modifying an activity to cater for clients with different abilities, it's important that you do it in a sensitive way. This involves making an effort not to draw too much attention to the clients who may be less able to do things compared to the others. It's important that you use techniques to motivate participants to maintain an appropriate rate of participation in the program. For example, you may find them a buddy. This is a great exercise to do, and to buddy up a client with another client so that they can keep each other motivated. You may have found that yourself when you join a gym. Often if you join the gym by yourself, you don't want to attend a few times a week by yourself, but if you have a friend that joins at the same time, you motivate each other to go. Another thing you can do is you can get the client to compete against themselves. You can use music. Research has shown that people who use headphones when walking walk faster than those who don't. You can be creative. By repeating the same exercises over and over, it can become boring. So you may want to keep people interested by using a variety of exercises. And finally, you will want to record the client's progress so that they can see, maybe with a calendar, the progress they've made over a length of time. As the program begins to conclude, you should consider concluding the program at a pace appropriate to the participants. It's never a good idea to conclude a program abruptly or to drag it out. Concluding the program at a pace appropriate to the participants' level of involvement is also important. Also, when concluding the program, it's important to consider the duration of the program. This is the conclusion of one session of the program, and you want to make sure that the clients don't have weeks and weeks without having another session of the program, because otherwise they're going to lose motivation and it's not going to have a significant impact on the client achieving their goals. At the conclusion of a recreation program, it's important that you collect and check the equipment, that it's not damaged and that there's no general wear and tear on it that make the equipment dangerous. Generally, checking equipment for damage and wear involves visually inspecting the equipment and using it as it should use. The manufacturers of the equipment you use may provide you with guidelines on how to check these, so make sure that you follow these guidelines. If in checking equipment for damage and wear you identify issues, it's important that you report this to your supervisor or the person in charge of the equipment or the maintenance man. Follow your organisation's policies and procedures in regards to equipment repair on this. I'd like to thank you for your participation today in this webinar. Continue watching this video now on warm-up exercises for the elderly.